Welcome to all of you who are joining us, whether you're viewing this as a live webinar right now or you're viewing this later as a recording. We're really happy to have you with us. My name is Naomi Hoffer, and I'm honored to be the program manager for the UCSF Sherry Sobrato Brisson Brain Cancer Survivorship Program. This webinar is a special offering in our monthly Living Well with Brain Cancer webinar series, which is a segment of our growing survivorship program that we've started at UCSF Neuro-Oncology Department, thanks to a generous donation from Sherry Sobrato Brisson. I'm delighted today that we have with us several esteemed members of our team on our panel of presenters. Featured today on our panel is Alexa Greenstein, UCSF Neuro-Oncology nurse practitioner for both the Neurocognitive Care Clinic and the Survivorship Program. Dr. Jennie Taylor, a neuro-oncologist who specializes in caring for adult patients with primary brain tumors and who is involved in several active areas of research focused on improving quality of life for patients as well as for caregivers. And Jane Rabbitt, who is the clinical nurse manager for the Neuro-Oncology Department and who oversees all nursing functions of the clinic, including research protocol. Thank you all so much for being on this panel. And I'm now going to turn it over to Dr. Susan Chang, who is the director of the UCSF Division of Neuro-Oncology and an internationally recognized leader in the field of neurological malignancies. Among many other of her esteemed titles, she is director of the Sherry Sobrato Brisson Brain Cancer Survivorship Program. Dr. Chang, it's an honor to have you here with us today to introduce this topic, and I'm now going to turn it over to you.
Thank you so much, Naomi, for that introduction. So I'd like to welcome and thank you all for joining us for a community gathering to learn about the current status of the COVID-19 pandemic and the response at the UCSF Brain Tumor Center. So while you're dealing with a brain tumor, hearing about the changing status of COVID must be really worrisome. And to avoid exposure and prevent infection, there are many changes that have affected the delivery of healthcare. But we want to make sure you know that your treating neuro-oncology team is here to ensure that your care is coordinated, and that your treatment is streamlined to minimize exposure and to keep you and the team safe. So this is our third webinar on the pandemic, and we will provide a COVID-19 update on the Delta variant, the various physical effects of COVID, and also review current guidelines, especially related to vaccination and boosters. We will also review the measures we're taking to safeguard you, your caregivers, and our staff as we continue to support your surveillance, treatment, or clinical trial course. So I'd like to especially thank Naomi for coordinating the webinar on a very short notice, and the members of the neuro-oncology team for sharing their expertise and their time for preparing the webinar and to participate with us today. So please do not hesitate to use the Q&A feature to note questions that we can ask the panel after their presentations. So I'd like to introduce Alexa, who I'll turn this over now to you to offer an overview of the current COVID situation, both globally as well as locally, and some specifics around the COVID disease itself.
Thank you, Dr. Chang, for the introduction, and Naomi as well. And thank you for everyone who is tuning in this evening or listening to the recording at a later time. And first, I just want to note and echo Dr. Chang's comments that this pandemic has been extremely stressful for everyone in our community and fraught with lots of stress, fears, anxiety, and other complex emotions. And I'm certainly very glad to be partnering with you in your care and making our way through this very difficult time. So with that, I'm going to start off with sharing some updates from a global perspective on the pandemic. And on a global scale, we are seeing a very high number of COVID infections, hospitalizations, and deaths in many countries. Worldwide, there have been over 226 million total COVID cases. And this number is likely an underrepresentation of the actual number of cases, since the number of people are going undiagnosed due to limited testing and access to healthcare. According to Johns Hopkins University, the US, along with India and Brazil, are leading the world in the number of confirmed total COVID cases. The coronavirus has claimed over 4.6 million lives to date. Over the last 2 months, we have witnessed an uptick in daily cases, which appears to be stabilizing. According to the New York Times, we're averaging nearly 600,000 new cases per day globally. Although things appear to be leveling off, the number of new cases per day is quite alarming. It's been almost a year and a half since the first case of COVID was reported in the United States. And since then, there have been roughly more than 41 million reported cases, which is more than the population in California, with more than 4 million of these cases reported in the last few weeks and over 660,000 lives lost. Many states are reporting higher case numbers and deaths compared to the winter surge we experienced last year. Nationwide, over 3/4 of people ages 18 or older have received at least one dose of the COVID vaccine. The state, interestingly enough, with the highest rate of COVID-19 cases per capita was Tennessee and has one of the lowest vaccination rates. Vermont, the state with the lowest rates of COVID cases, is also the state with the highest vaccination rate per population. Current level of transmission in the US is characterized as high. Testing data from the CDC notes that the 7-day average of positive COVID tests was 9.1, which appears to have decreased from the previous week and leveling off as a nation. This percentage is an important measure to keep an eye on because it gives us a sense of how widespread the infection is. According to Johns Hopkins University, yesterday's data revealed 143,895 new confirmed reported cases and 1,823 deaths. COVID hospitalizations have doubled since last year. However, there have been promising signs that this is improving. And just 2 weeks ago, our nation was averaging 1,500 deaths per day. However, this thankfully has been trending down. We continue to see that younger adults in the age ranges from 18 to 34 making up most positive cases, and deaths continue to be heavily skewed to older individuals. What's a bit different from our last COVID report a few months ago is that we're seeing more and more children diagnosed with COVID, but also in the unvaccinated adult population. Children newly diagnosed with COVID cases are making up 1/4 of new COVID cases, according to the American Academy of Pediatrics. With COVID cases on the rise, last Thursday, President Biden introduced a new 6-step plan to address the surge. And this mandate will require all federal workers, contractors, and large companies to enforce vaccinations, offer weekly testing for employees, and make booster vaccines more available, enhance efforts to protect school children, increase affordable and accessible testing, continuing masking requirements, and offer more COVID relief funding for small businesses, and provide more resources and personnel to improve care of those who are infected with COVID. Taking a closer look at California, California has over 4.3 million confirmed cases of COVID, resulting in roughly 67,000 deaths. These new numbers may not fully represent the true average, as there has been a delay in reporting due to a system upgrade last week. The rate of positive tests over the last 7 days is 3.5, which is a point. California is the only state to exit the CDC's high COVID transmission tier risk, which is likely a result of masking, social distancing, and vaccination efforts by our state. The state reported yesterday that there were 7,760 new cases of COVID, which is a 0.2 increase from the prior day, and 188 new deaths, which is a 0.3 increase from yesterday. Hospitalizations due to confirmed and suspected COVID infections have decreased from the prior day total. Less people are being hospitalized, but those that are being admitted appear to be in more need of intensive care based on the ICU bed capacity. According to the California State Health Department, data reveals that unvaccinated people are 8 times more likely to get COVID than fully vaccinated people. Vaccinations are a key and critical element in bringing the pandemic back under some semblance of control, and public health officials are starting to take action. A recent example of this was the Los Angeles School District, the 2nd largest school district in the country, now mandating coronavirus vaccinations for children ages 12 and older who attend in-person learning. On a county and city level, San Francisco has had over 48,000 confirmed cases and more than 600 lives lost due to COVID. Starting at the end of July and into August, we saw a steep increase in both cases and deaths. However, based on information available to us today, it appears the spread of COVID is likely decreasing in the area. San Francisco is reporting the current 7-day rolling average of new cases per day as 95. Because real-time data is still being calculated and validated, the running total reflects data through September 7th. And as of September 11th, the city has had 74 hospitalizations. Now getting a little closer to home, here at UCSF, we're very fortunate that our healthcare system has fared very well to other healthcare systems across the state. To date, the cumulative total of COVID hospitalizations across our UCS campuses have been 1,069 hospital admissions. And as of this morning, we currently have 29 individuals hospitalized who tested positive for COVID, 25 adults and 4 children, which represents a slight downward trend from last week. UCSF is at a level 2 surge with less than 5% positivity rate. A major reason for the spike in infection seen in California and across the country is a result of the rapid spread of the Delta variant, which has shown to be much more contagious than other previous variants. And just taking a step back for a moment, what exactly is a variant and why are they important? And are there any others like Delta that we should be aware of? So every time a virus replicates itself, mutations or errors in the genetic material can occur. Any change in the virus's original genetic material is called a variant. There are countless variants circulating and spreading across the globe as we speak. And some variants are harmless, while others can change the virus's characteristics, making it easier to spread, causing more severe illness, and can affect performance of vaccinations, testing, and other therapeutic treatments. Since the start of the pandemic, national organizations have been closely monitoring, studying, and surveilling various COVID variants. So the World Health Organization, along with the CDC, have defined categories of COVID variants based on potential threat. And as of last week, there are 4 variants that are of concern: Alpha, Beta, Gamma, and Delta. Delta being the most worrisome, as it makes up almost 99% of all COVID cases in the United States. The bar graph on the bottom right-hand side of the screen is from the CDC's Nowcast model, which projects the percentage of variants to COVID cases. The orange bar graph to the left represents the proportion of cases due to Delta. You can see on the graph how quickly the Delta variant has evolved since June. So why is the Delta variant much more dominant than others right now? The Delta variant has 2 key mutations that are believed to be main reasons as to why the strain has outranked all others to date. These mutations increases the virus's ability to replicate, bypassing certain antibodies made in the body, and allows the virus to invade tissue more readily. I know many folks likely have questions whether or not the Delta variant, as well as other variants, will impact the effectiveness of vaccines, and Dr. Taylor will be addressing this later in the presentation. Some other variants worth mentioning are Lambda and Mu. Lambda and Mu variants have recently caught the attention of experts because these variants carry mutations that can potentially affect vaccine and infection-induced immunity and transmissibility. There have been very few outbreaks of Mu and Lambda variants seen in the United States. Right now, there is more prevalent in other countries like Peru and South America. Unlike the Delta variant, we don't know as much about these 2 variants, and additional research is needed to prove whether these variants will be more dangerous and or resistant to current vaccines and treatment. As the virus continues to spread across the globe, it is expected more variants will emerge. And what is the best way to slow down, control, and prevent the spread of the virus and other variants is by getting vaccinated. Another way is limiting the spread through maintaining COVID safeguards such as wearing masks, physical distancing, practicing hand hygiene, and staying home if feeling sick. Although many of us by now know some of the common symptoms of COVID, it bears repeating. One can experience a spectrum of symptoms when becoming infected by COVID. The most common symptoms and features associated with COVID include cough, shortness of breath, fever, and chills. The CDC have also identified other associated symptoms such as muscle and body aches, vomiting, diarrhea, and new loss of taste and smell. Symptoms typically appear 2 to 14 days after infection. Many COVID symptoms are very similar to other respiratory viruses and conditions such as the flu, common cold, and seasonal allergies, which can make it very difficult to decipher the underlying cause or etiology based on symptoms alone. Also, individuals can have COVID and the flu, allergies, and other infections all at the same time. This table here was adapted from the Mayo Clinic and illustrates the many shared symptoms amongst these different viruses and conditions. If you're experiencing any of these symptoms, it's important not to dismiss them. You should contact your healthcare provider who can further assess and evaluate you and direct you to the right management and care. Last year, flu cases were nearly non-existent because of people wearing masks and social distancing. However, experts are concerned that this flu season might be severe given the lifting restrictions. Like COVID, the flu shot can help protect individuals against the flu, lessen the severity of illness, and reduce the risk of serious complications such as hospitalizations and deaths. Together, we're learning to navigate the complexities of these times, as well as simultaneously learn and better understand the novel coronavirus. Most people recover from COVID in just a few days or weeks. Yet there are some individuals who do not recover fully and experience a constellation of lingering and debilitating symptoms. This is often referred to as long COVID. The most common long-term health systems and effects associated with COVID, according to the CDC, are fatigue, shortness of breath, difficulty concentrating, smell or taste, memory trouble, anxiety, depression, sleep disturbances, fevers, and gastrointestinal symptoms. In some cases, individuals go on to develop new symptoms after their acute infection and/or their symptoms evolve over time. There have been cases of a rare inflammatory condition associated with COVID that can damage multiple organ systems. This has been seen primarily in children, but also in some adults following COVID infection. These long-haul symptoms and post-COVID sequelae effects are turning out to be more common than we originally thought and have the potential to impact millions of people worldwide. So to address this, Congress provided the NIH with over $1 billion in funding to better understand, prevent, and treat the long-term effects of the coronavirus. In addition, a growing network of long-term COVID centers and care facilities across the United States have been created to address and manage unmet long COVID symptoms. Here at UCSF, the UCSF Optimal Clinic was created to bring together specialists from the departments of pulmonology, geriatrics, and psychiatry to care for adult patients who were hospitalized with COVID or have persistent pulmonary symptoms. UCS Davis Health is another post-COVID clinic developed to help treat patients for a variety of symptoms. More information of these clinics can be found on their website listed on the slide. As we enter the fall and winter months, people are starting to have conversations ahead of time and about their upcoming holiday celebrations and gatherings. Questions about travel are a common concern for many individuals, especially those living with brain cancer. Many are wondering if it's safe to travel considering the surge of COVID cases seen worldwide. We know that traveling increases the chances of COVID infection and spreading the virus, and the risk of COVID infection hospitalization is much higher in those who are immune compromised. But we also know that people value and cherish time with their families and friends and doing things that they love, which may involve traveling. The CDC strongly recommends individuals should delay traveling both domestic and internationally until they're able to get fully vaccinated. Before booking or planning a trip, the best thing to do is make sure you get vaccinated and talk to your healthcare team about your plans. Your doctors and care team will help discuss your own personal risk and advise you on any necessary restrictions or precautions you should consider before traveling. For unvaccinated travelers who are embarking on domestic travel, the CDC recommends getting tested 1 to 3 days prior to travel and 3 to 5 days after travel and self-quarantining after your trip. Both vaccinated and unvaccinated travelers are recommended to self-monitor for symptoms, wear a mask over their mouth and nose on public transportation, and take other precautions during travel, such as frequent hand washing and social distancing, as these measures are critical to ensure everyone remains safe and reduces the risk of transmission. International travel, the CDC requires all air passengers entering the United States to present a negative COVID test taken within 3 calendar days of departure or proof of recovery from the virus within the last 90 days. Airlines must confirm negative test results or proof of recovery for all passengers 2 years of age and over prior to boarding. Regardless of vaccination status, the CDC recommends that travelers self-monitor for symptoms, wear a mask, and take other precautions during travel as mentioned earlier, and get tested 3 to 5 days after travel. Those travelers who are not vaccinated, the CDC recommends getting tested 1 to 3 days preceding traveling and self-quarantining after travel for 7 days with a negative test or 10 days without a test. Local and state and national COVID regulations are constantly changing. Less than a few weeks ago, the European Union banned non-essential travel for American travelers. It's very challenging to keep up the ongoing real-time changes that are occurring. For those who are traveling abroad, it's recommended to check the U.S. Department of State for up-to-date entry requirements and travel warnings before you plan or embark on your trip. The CDC also has a wonderful resource that offers current COVID and other travel health notices and recommendations by destination. Although the last few weeks and months have been especially difficult battling the Delta variant, the strength and patience of our community will help us see us through the remainder of the pandemic. With that, now I want to turn over to Dr. Taylor, who will lead us in an overview of the COVID vaccines.
Thank you, Alexa. Let me hopefully everyone can see my screen.
Looks good, yes.
Great, thank you so much. All right, well, thank you. I see a lot of familiar names as a participant today. So thank you all for making the time. And I think a lot of the information that Alexa gave us has been daunting. And I think this is truly an incredible experience that we've all gone through together in facing this pandemic. But this was my first slide at the last COVID update that we did back in January at the very first of the year. And it's the vaccine, and the vaccine is hope, and the vaccine is an incredible miracle. We all have questions, of course, about the vaccine. It's happened very rapidly, but it's been just incredibly beneficial. And I'll intend today to talk a little bit of a refresher course about the vaccines themselves, kind of how they work, as well as some of the expected side effects. I'm sure many of you might be on the call today wondering about booster vaccines for brain tumor patients and whether that will be relevant to you. So I'll touch on that as well. And then also kind of give a status update, and thanks to Alexa for her help with the slides of vaccinations around the world. So really the importance of vaccines and why we need to really be focused on vaccinating the entire world. So the vaccine is a sign of hope. So how do these vaccines work? Well, the two most common vaccines that I will refer to as the Pfizer and the Moderna vaccines, which are undergoing new naming based on FDA approvals. But those are messenger RNA vaccines and really are pretty revolutionary in how they work. So what happens is that scientists have been able to take genes from spike proteins, or things centered on the surface of the virus itself, and then put them into harmless viruses that are then injected into our arms. And what that does then is, as the vaccine enters the cells are reprogrammed to try to produce this spike protein. So it's not the virus itself; it's a little blip on the surface of the virus. And by having our cells produce these extra spike proteins, then our immune system starts to recognize those spike proteins as something that shouldn't be there, and it revs up our immune systems in order to try to combat those new spike proteins. And that's why we have symptoms as it relates to the vaccine. But the intent is to teach our immune system to recognize through antibodies and T cells as foreign from the spike proteins. And then that way, if we were to get exposed to COVID, then our immune system has learned how to fight it off. And so that's the way that these particular vaccines work. So this is actually, again, the slide that I used back from January of 2021. And this is really what generated approval, emergency use approval for these two vaccines. And I think, as everyone is aware now, the Pfizer vaccine has received full FDA approval. So the intent was really to deliver millions of doses by the end of the year. And originally, the Pfizer vaccine was approved for people 16 years and older. That was the original clinical trials in which it was tested. And what it originally demonstrated was effectiveness of 95% of death and reduction in hospitalization. So it doesn't mean that you still can't get the virus. Sometimes when your immune system tries to learn something new, it may not be perfect, but it can certainly try to dampen any severity of the illness going forward. And as everyone I'm sure on this call is familiar, the Pfizer vaccine is 2 doses, recommended about 21 days apart, though they've been able to do additional vaccines up to 6 weeks apart for efficacy. And now that this has been approved by the FDA, it's actually approved for use down to the age of 12. Then that was the first vaccine that was approved in the United States. So then the Moderna vaccine, actually, no, that's not true. The Moderna vaccine, I think, was originally the first one approved. So this actually has also demonstrated effectiveness of death and hospitalization. So getting very, very sick from COVID. And of course, we all remember the winter surge that we were in the midst of back in January, when our hospitals were really full and the death rates were really very high from COVID. Again, the Moderna is 2 doses, 28 days apart. This one has not yet received FDA approval, but received emergency use approval still for ages of 18 years and older. And then what we've learned in the meantime is the immunity really is effective and sort of peaks, not peaks, but goes into effect about 2 weeks after the second vaccine. So a lot of the precautions that we've all become very, very familiar with, overly familiar with, is certainly really important to maintain even up to 2 weeks after the vaccination. Then also the Johnson & Johnson or the Janssen vaccine has also received approval. This is a little bit of a different technology, more older school technology, if you will, and using our cells still in a general way of introducing a piece of the virus, so not the actual virus, but a piece of the virus to educate our immune system in order to trigger an immune response when exposed to the vaccine. As everyone knows, I think that the Johnson & Johnson Janssen vaccine is a single dose, which was something I think everyone was very enthusiastic about. And then the immunity was still thought to be about 2 weeks after the dose. This is still received emergency use only for patients, people who are over 18 years of age. So what are some of the side effects? Well, I think common side effects that maybe many of you experienced while you were when you received your vaccines is certainly pain, redness, and swelling of the arm. I actually happened to get my flu shot today, and it's reminiscent of my COVID shot from back in January. So I think this is the most common and universal symptom for patients, for anybody who gets their vaccine is kind of soreness in their arm. And then because you're educating your immune system to recognize that little spike protein that it's being exposed to, and that's true regardless of the type of vaccine that you received, your immune system is studying really, really hard and working very hard to try to learn how to recognize that. So there's often very diffuse and systemic symptoms that can happen: fatigue, headaches, muscle pain, chills, fever, nausea. And these have been pretty consistent across all of the variants for the vaccine and vaccines. And I'll talk a little bit about some of the unique toxicity or very rare side effects for some of the particular vaccines, but these are general for any vaccine, including flu vaccines or shingles vaccines or any other types of vaccines. And I think a lot of people have had some experience with vaccination, with having these symptoms after their initial vaccination or after their second vaccination, after both or after neither. To my knowledge, there's no sort of relationship in the effectiveness of the immune response to a vaccine and the side effects that you experience when you've received the vaccines themselves. And then helpful tips to relieve side effects is really to use a clean, cold, wet washcloth over the area that has been where the injection is. Maybe I'll do that at the end of my day today. And then using or exercising your arms, so not just kind of holding it there, but allowing sort of blood flow so everything kind of the muscles relax and the immune response is less localized. And then certainly drinking plenty of fluids and in case you have fevers, dressing lightly, and then also taking Tylenol or ibuprofen or some anti-inflammatory if you do have these systemic responses. So it's not recommended to preventatively take those medications before the vaccine, but you can take them in reaction to side effects with the vaccine. So again, there is not a risk of contracting COVID from the vaccines. The vaccines are not made from fetal tissue. They're generated in a lab and very well controlled. And then again, you're considered protected from the vaccine 2 weeks after receiving it. And millions of people have received the vaccine with no known long-term side effects that have been detected, though there are some acute side effects that I'll talk about, particularly that's noted most commonly with the J&J vaccine, of thrombosis and thrombocytopenia, TTS syndrome, as well as Guillain-Barré syndrome, which I'll also note is something that's seen rarely as a result of the flu vaccine also. So these vaccines are not 100% effective in preventing COVID, and just as anything that we put into our bodies, any foods that we eat or place that we travel, new laundry detergent guaranteed not to have a reaction to the body. And so there are some rare side effects that have been very well delineated and captured over the course of since the vaccines have received emergency use. So this was from the CDC website, and I think you'll also notice as in reviewing the slides from today that both Alexa and myself have mainly relied on the CDC, which has really done a great job of generating some very patient-friendly, very simplistic guidance on the coronavirus, as well as the vaccine. So I encourage everyone to sort of use that as a great resource for additional questions. But this is sort of kind of a modeled approach of trying to understand the risk versus the benefits of the vaccine. That's of course what we all want to know, is what are the risks if I have a complication from the vaccine, and what are the benefits, just like any other treatment, like surgery for your tumors or any treatments for your tumors. And so these are here in the sort of top two columns. It's divided up by age and divided up by gender. And so the top is the Johnson & Johnson Janssen vaccine. So again, the Guillain-Barré syndrome, which is sort of a neuropathic syndrome, which is seen by, again, in other vaccines, as well as viruses themselves. And then this additional blood clot generating abnormal syndrome that I'm sure you've probably heard in the news. So you can see here that the numbers of these are very, overall are very low, for the most part, single digit numbers. Some of these risk factors do increase with age, as is true for so many different things. But then as you move to the left, you can see the total number of cases that are prevented by receiving the dose of this vaccine. So here you have patients, male patients greater than 65 years old, where you're preventing up to 37,000 cases, almost 12,000 hospitalizations, 3,000 ICU admissions, and 2,300 deaths as it relates to, in relation to the vaccines. And there have been a few cases of myocarditis that have been noted with the mRNA vaccine. Again, overall, very, very small numbers, and then proportionally really incredible reductions in some of these, in what we know to be really, really serious disease with COVID. So globally, we have 5.76 billion vaccines, and this isn't broken down by any particular vaccine. And of course, here in the United States, we have 3 vaccines. There's other vaccines that are included in Europe. There's different vaccines in Russia and China and different parts of the world. So it's not, so this is sort of a summary of all of the different vaccinations, not specific to any one particular vaccine. So I can't remember what the population is of the world right now, but it's certainly a lot more than 5.7 billion. So a lot of room. But just if you look at this incredible curve, which of course we're all used to looking at these curves now over the last year and a half, just the really ramp up in the amount of vaccinations that are being delivered. So certainly a long way to go. But I do think that we should acknowledge the incredible headway we've made in the last 9 months. And then this is more some specific data as it relates to the United States. So at least 209 million vaccines have been given within the United States, and about 179 million people are fully vaccinated, which is only about 54% of the total population. And these additional rows just are breaking things down by particular age groups. And so you can certainly see that patients who are the age group who can be most at risk for complications as it relates to COVID, elderly patients, people who are over 65, that we're doing overall pretty well for most of those, for that patient population. So I think that's helpful, trying to, again, kind of protect our most vulnerable. And then just to kind of go a little bit more into detail regarding California here on the left, and then San Francisco here on the right. So Los Angeles actually has delivered 12 million vaccines, which is really quite incredible. Of course, it's a huge county with a very, very, very large population. And so I think that the bar here, the blue bar that you see, is not necessarily reflective of the total amount of vaccine per population, but just the total amount of vaccine delivered. So I think down here in San Francisco, if you look here on the right, we have about 1.3 million people vaccinated within overall within San Francisco, which is a pretty large percent of the population. So we're doing well, and I think in the Bay Area in general, with our town hall meetings that we have once or twice a week, that the Bay Area has really done an excellent job of being protected and getting patients vaccinated. And then UCSF also is either mandating vaccines, or if you have a religious or a medical reason to not receive the vaccine, then having to get tested very frequently. And I think Jay may speak on that as well. So the vast majority of UCSF is vaccinated as well, fully vaccinated. So we've done all this work. We've had all these positive results. I think all of us experienced a couple of weeks, some glorious weeks in the summer where we felt that we were on the back nine of this terrible pandemic, and then the Delta variant came along and really, I think, highlights the immense challenges of all of us learning all of this information in real time. And I think the science behind all of COVID has just been incredible to live through, how much we need to learn, how much things can change, and how flexible we all need to be. This is not something that anyone in the world has had experience with until December of 2019. So we're all having to learn, and unfortunately, there's been an immense amount that we have learned. But as we've learned, we've had to pivot and make changes. And of course, that meant that we all needed to start wearing masks again, restricting our travel and being more cautious. And the reasoning behind that, as Alexa had alluded to, is the virulence of the Delta variant. And so again, it's a particular alteration within the coronavirus itself, and it's made it more infectious. So originally COVID, for one person as an example here, it would infect 2 different people. Now with one person potentially has the possibility of infecting 5 different people. So it's certainly, it's adapted. That's what viruses do. It's survival of the fittest. And so it's trying to figure out ways to adapt. And I think that this really highlights an additional critical piece of getting everyone vaccinated, regardless of what corner of the world, is that if we let this virus continue to run rampant, it's going to continue to mutate, and we're going to end up in this sort of vicious cycle until we can hopefully get the majority of the world vaccinated. And so, of course, as all of this was happening, we all probably had personal experiences of hearing from someone who ended up with a breakthrough infection. So people who were fully vaccinated, people who've been very cautious during those glorious weeks, in particular over the summer, where we all kind of felt like we could let our guard down a little bit, if we were vaccinated and we were receiving guidance from the CDC and of course our government, that we were sort of allowed to do that, to sort of let our guard down if we were fully vaccinated, and then people started getting sick again. And so the importance of the vaccine, and some may say, well, if I'm going to end up getting COVID, regardless of whether or not I'm vaccinated, then I think what we're counseling our patients to consider is that what we know to be true is the vaccines do shorten the time that you can spread the Delta variant. They can protect you from So even though you may still get sick, you're much likely to recover more quickly, even though there are probably instances of long COVID with the virus. It's certainly a much lower risk if you're vaccinated. You can spread it to your loved ones over a shorter period of time if you're vaccinated, and then you're much less likely to end up hospitalized or to pass away from the virus. So again, protecting your loved ones and community from spreading the virus. And then again, it's really important to prevent new variants from emerging by making sure that we all continue to get vaccinated. So the bottom line is that COVID-19 vaccines protect people against severe illness, including disease caused by Delta. So the vaccine still works against Delta. It's just that Delta is you're more likely to end up getting exposed to Delta, because as Alexa showed you those beautiful graphs, this is certainly the most common variant now throughout the entire United States, and that's been a very rampant, very quick uptick. So as far as we know, any variant variants that are circulating currently in the United States are sensitive to the COVID vaccine. So they're all still working. So the vaccines protect people from getting infected and severely ill. So again, the severely ill and death is what's really, really intended for the vaccine. It is true that you might still have a breakthrough infection, but you're much, much less likely to get sick or pass away or end up hospitalized, severely sick, hospitalized or pass away with if you've been vaccinated versus not. And then the best way to slow the spread and to prevent infection by Delta or other variants is, of course, to get vaccinated. Though people who are vaccinated can still get infected, the risk of, and there is still a risk of transmission to others, which is why we've had to go back into masks and be much more socially distant, et cetera. If you're vaccinated or unvaccinated and live in or work in an area with a substantial or high transmission, which is certainly the majority of the United States, then you, as well as your family and community, will be better protected if you wear a mask when you're in indoor public spaces, as well as potentially outside in crowded spaces. And then my next slide is going to be particularly relevant for patients who are immunocompromised, for whom we've been worried all along. And it seems like this has been the case, that for people whose immune systems are weakened and the immune system may not be able to learn as well, if you will, from the vaccine injection in order to protect you from your exposure, then potentially you need to certainly be extra careful, as well as potentially receive an additional dose. So the way that they're describing this dose is actually a third vaccine dose for immunocompromised. And it may be as we go forward and in managing COVID-19 that we do consider 3 doses versus 2 doses for people whose immune systems are more vulnerable. So who currently needs an additional COVID-19 vaccine? And so currently, the CDC is recommending that moderately or severely immunocompromised patients receive an additional dose. So there's some language about a booster dose versus a third dose. And I think what's intended here is that probably over time, everyone who's immunocompromised on active chemotherapy, et cetera, will need to receive 3 doses in the future, as opposed to a quote unquote booster shot. So people who are receiving active cancer treatment for tumors, solid tumors, which would include brain tumors, and cancers of the blood should receive another dose, a third dose of their vaccine if they've received either the Moderna or the Pfizer, so the mRNA vaccines. If you've received an organ transplant and are taking medications to suppress the immune system, again, it may not learn as well, so you may need a third dose in order to really educate it about the coronavirus. If you've received a stem cell transplant within the last 2 years or taking medication to suppress the immune system, if you have some particular primary immunodeficiency, so the immune system not being able to learn as well, if you have advanced or untreated HIV, or if you have active treatment with high doses of corticosteroids, which is not necessarily defined here, but I think in general, most of us are using any corticosteroid dosing for dexamethasone, for example, for our brain tumor patients as enough risk to be considered for an additional dose of the vaccine, and other drugs that may suppress your immune system. So of course, and I've certainly talked to many of my patients about receiving an additional dose, a third dose of the vaccine. Again, if you've received, currently the recommendations are either the mRNA vaccine, the Pfizer or the Moderna. The Johnson & Johnson Janssen is still under review at the FDA. And the recommendation is that currently you receive that third dose at least 4 weeks from your second dose. So what about vaccine boosters? So again, a little bit of a nuanced technical difference in boosters versus third doses. And so those of us who have been vaccinated will probably need a booster shot at some point within the next couple of months. So when can I get a COVID-19 vaccine booster? So not immediately. The FDA is reviewing the need and the trajectory for the timing to get a booster shot for patients, for all of us who've received at least 2 doses of our previous vaccine. It seems that the antibody response does seem to wane starting about 8 months after having received your second dose. So for those of us who are healthcare workers, who received our doses in January, and for those of you who may have received an earlier dose, during the course of their initial vaccine rollouts. The thought is that we probably in the fall will maybe need to start getting a booster shot. So this is subjective to authorization by the FDA, and they're really being very careful about who it is that may need a booster shot, how to roll out the booster shots, and how to allocate this discussion that I mentioned earlier about booster shots here versus allocating vaccines around the world as well. And then who will be the first people to get booster shots? The thought is that we probably will end up, it'll be timeline. And of course, that timeline in the original phase and rollout for the vaccines were sort of very, very clearly delineated. So healthcare workers, people on the front lines, followed by people who were older, and then sort of working your way down by age groups. So that's likely the way it'll be rolled out again. And then now, of course, the Pfizer I've recommended to get their booster shots. Currently, it's a self-attest. So you go to the pharmacy and or a local clinic and attest that you are an immunocompromised individual who needs a third dose, and there's no doctor's letter or anything like that that's being recommended. And I haven't had any issues of anybody needing to get being turned away from receiving a third dose, though we'll see how everything is implemented with these booster doses. And then I know there's been a lot of conversation about antibodies. Currently, antibody titers are sort of how well your immune system learned the coronavirus with the vaccines. There's a lot of interest around this. It's not currently standardized in a way to being used to recommend additional vaccines or the timing of additional vaccines. So I think there's a lot to learn from that aspect of things, but it's still something that's a bit nuanced and is not necessarily used across the board for prime time. So I think as opposed to response to antibody titers, I think the booster shot will probably be more implemented or realistic to do a rollout similar to what we experienced in the winter. And then just a plug for your flu vaccine. Alexa mentioned this as well. Again, I got mine today. It's a little bit of a different way to make vaccines. It's actually an inactivated or killed version of the flu. And of course, as we know, we get a different flu strain every year. So every year the flu shot, we need a new flu shot every year to protect us from that year's strain. Again, it significantly decreases the risk of getting very sick from the flu and requiring a hospitalization. So the intent here is not 100% protection from the flu, but is protecting you from getting really sick and overwhelming an already overwhelmed medical system right now with COVID-19. And as Alexa mentioned, there may be some concern that this is a bad flu season, given that we really skirted through last year. So all of the distancing and all the things that we've been doing, we'll need to continue to do to help prevent the flu. And it is okay to receive the flu shot and the COVID booster or any of the COVID vaccines in a relatively close time together. Your arm might be pretty sore, but there aren't any significant overlap. Hopefully your immune system can learn both things fairly simultaneously. And it's approved actually for everyone older than 6 months old. It is actually generated as an egg product. So if you have allergies to eggs, there are other versions of the flu vaccine that can be considered. So keep up all of the safety measures. As I mentioned, the virulence of the Delta variant and other variants that may end up coming our way, it's still important to wear a mask, as we all know the mask helps protect us from spreading the virus, but also helps protect us from getting exposed to the virus. So if we all wear masks all the time, then we're significantly cutting down the risk of transmission. Staying 6 feet apart is still something that's generally being very recommended, and certainly avoiding crowds. And Alexa did kind of steal my thunder, because this is all working. Getting vaccinated, the vaccine rates in the Bay Area, in California, staying masked, doing the things that we need to do to help protect our community. It's working. We are actually the only state as of yesterday that's advanced out of the high COVID transmission category into a more moderate, but still significant. So we can't let our guard down. We need to continue to do what we've been doing, but it is working. It is proof of concept. And then, so just a quick summary, getting vaccinated against COVID-19 significantly improves the risk of hospitalization and death from COVID. Though the Delta variant is more virulent, the vaccines are still highly effective. A third dose is recommended for patients undergoing treatment for tumors and cancers. Booster shots will likely be recommended by the FDA and CDC in the fall of 2021, but we don't have dates about that yet. Stay tuned, that will certainly be in the news, and then UCSF will give us continued amazing guidance about that as well. And then certainly important to get your flu vaccine and keep up your precautions. And with that, this is my vaccine from initial one back in January. And so please, everyone, if you haven't had the chance to get vaccinated, please continue to consider it. And then with that, I'm going to turn it over to Jane Rabbitt, who really runs our neuro-oncology division, and she's going to address the way that we're continuing to keep our patients and staff safe and protected at UCSF.
Thanks, Dr. Taylor, for that really informative presentation on COVID and the vaccine. You answered so many questions that I hear from so many patients and the public, so thanks so much. I'm Jane Rabbitt. I'm the nurse manager in the Neuro-Oncology Clinic. Often you won't see me, but I am there. Never did I know that 18 months after beginning having COVID enter the United States, that we would be continuing to navigate this impact of COVID. But we have learned so much, and we continue to have your health and safety as our priority. So I'm going to share my screen. So to begin, we're going to look at what the precautions UCSF and our clinic have taken. So we're going to begin to look at your experience as a patient here at UCSF. We will review the appointment pre-screening and testing process, the requirement of face coverings and the limited number of visitors, the option of telehealth, the steps that we've taken for infection prevention, and that all patients that are positive for COVID-19 are cared for in separate units. So they're separated by the clinic, by their hospitalization units to enable us to prevent infecting our visitors. Most importantly, as we start, if as a patient you have potential COVID-19 symptoms, please do not come to the UCSF. Instead, call the COVID hotline at 415-514-7328. And the COVID hotline team will help you go through your symptoms, make an assessment of the risk of whether they potentially could be COVID, and recommend whether you need further evaluation or if you need testing. If you do require testing, the COVID team will assist you in that process. And all UCSF patients are provided testing for free, and the results are available within 24 to 48 hours. As you prepare for your visit with us, you will be sent an electronic COVID-19 screening assessment the morning of your appointment through MyChart. When you arrive at UCSF, you will then need to show the lobby screeners, kind of pictured there, his little spot, your clearance on your phone. It is okay if you forget. The lobby staff will review the questions with you, and once cleared, provide you with a face mask and a sticker prior to heading up to the 8th floor for your appointment. Your mask must be worn at all times when indoors in any building on any of the campuses at UCSF. And it has to be worn properly, which means it must cover your nose as well as your mouth. Currently, UCSF, based on the tiers that Alexa talked about earlier tonight, we are only allowing one visitor to accompany a patient at all our outpatient locations at all the UCSF campuses. I do want to note that the infusion center on Parnassus only allows visitors on a case-by-case basis due to space restraints. So please coordinate with the neuro-oncology nurses so that we can make sure if you do require a caregiver that we can help accommodate that during the infusion center. All visitors must also pass the screening assessment and will do so prior to the appointment by going to the link below. If they go before your appointment to tiny.ucsf.edu/entry, it's a very simple, user-friendly screening. And then you again would show that at the entrance. If you forget as a visitor to do the screening prior to this appointment, again, the lobby staff will screen you with the questions and allow you to have clearance. So these are some of the signage that you're going to see around UCSF. The far one on the left that says take care and be kind, it's a little hard to see, but it basically is telling you together we can prevent COVID-19. We can prevent it by maintaining social distances. We can prevent it by having really excellent hand washing and doing it frequently. Wearing our face covers, our mask appropriately over your nose and mouth whenever you're indoors. To complete the health screening prior to coming to UCSF and answering it honestly. And wearing ID badges for all staff. The center picture are the questions that you are asked prior to your appointments here at UCSF. And just to go over them, it will ask you both here in their lobby or online in the electronic screening. In the past 14 days, have you experienced any of the following new, universal, or worsening symptoms? And they ask for, have you had fever or chills, cough, trouble breathing, sinus congestion or runny nose, nausea or vomiting, diarrhea, unexplained muscle aches, loss of taste or smell, or eye redness or discharge? In the past 20 days, have you been diagnosed with COVID-19? And that has to be an actual diagnosis from a physician with a test result. And in the past 14 days, has anyone living in your household or with whom you've been in close contact have symptoms of COVID, have been tested but are waiting results, or have been diagnosed with COVID in the last 14 days? If you answer yes to any of these, you will have further assessment and possibly be taken around the corner to our respiratory assessment clinic for further evaluation. And then the little additional sign is just to remind people that we still can get COVID even though we've been vaccinated. So we're asking you to please answer the questions and work with our staff so we can make sure your visit and all our patient visits safe. And then on the far right is Eric at our front desk in Neuro-Oncology and the neurosurgery office. And you can see that there's plastic plexiglass between you and him. You'll see this throughout the campus, and it's to protect you as well as our staff from any possible transmission. We continue to offer telehealth visits when appropriate, and you can use your smartphone, your iPad, or your laptop, and we'll receive instructions to help you through the process. And even if it's the moment you're supposed to go on your Zoom for your telehealth, our staff, our program coordinators can always assist you, as well as we've had patients come to the clinic and sit in a room by themselves so that they can Zoom in with their physicians. All the exam rooms and the equipment undergo intensive deep cleaning between patients. So please know there might be a slightly longer delay as you go through the clinic to accommodate this process. Now we're going to review some of the precautions staff are taking, again, to protect you as well as each other. So staff must go through daily health screening as well. They must wear what we call personal protective equipment at all times when indoor, again, in any building on all the campuses at UCSF. They wear the mask covering their nose and mouth, and they also will wear eye goggles or a face shield. We've decreased the number of staff on site through March 1st, 2022. So staff that is not involved directly in patient clinical care, we're having them work remotely just to reduce the total volume of people on campus to help us with that physical distancing. Infection prevention, again, we're deep cleaning all of our facility. So even our offices and all the places that we have high touch, so that we prevent any infection. And like Jennie Taylor mentioned earlier, there is now a mandate that all staff at UCSF have COVID vaccines, and they have really restricted any of the exemptions as of today. But those who have a medical exemption that's been reviewed will be allowed to continue to work with weekly COVID testing. All the treatment options are available at UCSF. We are performing surgeries, radiation therapy, providing chemotherapy, and clinical trials. The medical center and the cancer center truly understand that the care for our brain tumor patients is essential. And we're enrolling patients in all phases of the clinical trials at this time. So both therapeutic and non-therapeutic trials are available for patients. New patient referrals are continuing to be processed through our amazing nurse navigator, Stephanie Lewis. And we now have the option, or continue to have the option, for video visits as opposed to only telephone consults, as well as on-site visits. Our supportive care services are available to all our patients and to their caregivers. And listed below, the Gordon Murray Caregiver Program, the Sherry Sobrato Bryson Brain Cancer Survivorship Program, the Neuro-Oncology Care Clinic, which provides education and rehab visits virtually and cognitive testing on site. Our UCSF Brain Tumor Support Group and Caregiver Support Group is very active and available by Zoom. And we have a medical social worker that's on site as well as available for phone calls and Zoom. Then UCSF has compiled really great resources for COVID, and 2 of these are listed below, kind of helping you navigate through all the facts and the fiction that we hear about COVID vaccines, and also how to help cope with all the issues that the COVID has brought to us and how to take care of us and our well-being.
Thank you so much, Jane Rabbitt, Dr. Jennie Taylor, and Alexa Greenstein, for that really, really comprehensive overview of all that we're talking about. So I'd like to remind you to please submit your questions using the Q&A function, and I am going to invite my panelists to please come back on, and we will ask the questions as they come in. First of all, Jane, if you don't mind answering this question, when you refer to universal symptoms, what do you mean by that when you talked about new universal or worsening symptoms? What do you mean by universal?
We're looking for those very specific symptoms. It is interesting because sometimes people have allergies or they have a cough that they've had for years and years and years. They're really looking for new symptoms or for symptoms that are worsening over the last 14 days. But again, very specific to the chills, to nausea, diarrhea, loss of smell and taste, muscle ache are really what they're looking for.
Got it. Thank you. Thank you so much. And another question, can someone who has been vaccinated end up with long COVID? Dr. Taylor, would you like to answer that one? You're muted.
Thank you. Sorry about that. So yes, I do think there are probably case reports. I think vaccinated people who gotten COVID have probably had it not very long, right? Just sort of over the last relatively few months. So I do think that is a risk. I think we'll certainly learn more, both the severity and the quote longevity of long COVID, but we don't understand, as Alexa sort of alluded to, why some people really do develop symptoms related to long COVID. So I think it may be that presumably things that are less intense or much less likely to develop those symptoms if you've been vaccinated, but it probably, as I discussed, is not an absolute that you can't get long COVID if you've been vaccinated.
Thank you so much. And now, is it easy to get an antibody test to see if the vaccine is still working at a high level?
Sure. Yeah. I'll take that one as well. Sure. I think the answer to that question is yes. The problem is what does it mean, and how is this information being practically used? I think there's a lot of antibody research that's going around, and information that I think is going to be helpful. I think the problem is, antibodies against one type of variant versus a different type of variant is, whether that's something that's going to end up being necessary, or whether that means that how long that antibody titer is likely to hold up. So I think that this is really an area of a lot of active research that we just don't know answers to. And so, as I mentioned, I think the CDC currently is not recommending using antibody titers. So an antibody titer is kind of a signal of response, how well your immune system learned the vaccine. And I think it's not using that currently as a guide as to whether or not they're recommending it. So for my patients who are immunocompromised, who are getting active treatment, I'm not doing an antibody test to say whether or not they should get a third dose. I'm recommending it across the board, hopefully. And I don't know if Dr. Chang has a different answer to that, or Alexa, but that's my understanding of the current literature.
Great, thank you. And then Jane, this one could be for you. I believe I'm a healthcare worker who is vaccinated and have chance of taking care of COVID positive patients. Will I need additional testing or screening when I go visit my doctor at UCSF?
No, you don't need additional testing. You will have to have that screening assessment. And as long as you can answer those questions in a positive approach, you'll be allowed in. So when we talk about close contact, it's close contact without protection for greater than 15 minutes, less than 6 feet apart. So that's those guidelines. And we've definitely had that with staff and patients where they really do define that. But again, as long as you have a mask on, you're greater than 6 feet, then you should be okay. And as a nurse caring for those patients, you absolutely should have your your personal protection on.
Thank you. And I think I'm going to ask you again, Jane, if I could. There was a question that came in earlier around, do patients need to have proof of vaccination for any events or appointments at UCSF?
I can take that one. So currently in the ambulatory setting, so outpatient, you are not required to be vaccinated or show proof of testing. You just need, again, to answer those screening assessments. However, if you are a visitor for someone inpatient, and based on their allowance for visitors, you either have to show your vaccination status or you have to have a negative COVID test within 72 hours of your visit.
Got it. Okay, thank you.
Oh, I'm sorry, just to say that, so for people who are undergoing surgery and for people who are admitted to the hospital, I believe everyone is routinely tested for COVID as just part of your standard admission to UCSF.
Correct. Agree.
Got it. Thank you. And Dr. Taylor, what guidance is there for those of us who received the Johnson & Johnson or Janssen vaccine?
Yeah, it's a good question. I think the challenge with the J&J vaccine originally was that it was developed and tested kind of at the time when when the Delta variant around the world was starting to gain a little bit of hold. So I know when it came online, there were questions about it was less effective, and so it's just that data was generated at a time that was very different than the data that was generated for the mRNA vaccines, the Moderna and the Pfizer. So I think that I don't know the answer. I don't know that we know the answer. I think that there may be opportunities for patients who've received the J&J vaccine to potentially get a different vaccine. I think currently patients who are recommended for the third vaccine, and I presume for all of us as we consider a booster vaccine, that we would intend to get the same vaccine that we had received originally. It is not my understanding yet that they're recommending a second dose of the J&J vaccine, or definitively recommending people to have to receive a different vaccine if they did receive the J&J vaccine. So I think all of this is being really heavily investigated. And I think some of it is as it relates to some of the very rare, but still the toxicities and side effects that have been noted in the J&J vaccine that hasn't necessarily been seen in the mRNA vaccine. So stay tuned, but I think it is helpful. It's certainly better to have the J&J vaccine than not to be vaccinated, for sure. But I think as we roll through in time, we have still more to learn. Hopefully that's satisfying answer.
Yeah. Thank you. Thank you so much. And here's an interesting question. What can I say to family members who believe in the conspiracy theories about the vaccine? Any thoughts around that? I'll open it up to whoever would like to answer. Dr. Taylor, do you want to?
All right. Yeah, I think this is really challenging. I think having discussions with your community about the vaccine is really challenging. I think it's there's a lot of science behind this. I certainly think all of you here on this call are UCSF patient. Many of you, I think, most of you are UCSF patients, and I think trust your doctors, certainly at UCSF. So I think we've all been vaccinated and really believe in trying to stamp down this seriousness of this incredible pandemic. So I think what we know and what we're experiencing in other parts of the country in particular right now is how serious COVID is and how overwhelming COVID is. To the hospital for people who have health issues, who don't have COVID, can't get into the hospital to have brain surgeries and things along those lines. I think, as I mentioned before, it's not made from fetal tissue, that these vaccines have emerged in miraculous time. I will certainly acknowledge that, but that's a testament to the science in the 21st century. So I think if there's specific questions, it can be a heated discussion, an emotional discussion. I think the CDC is certainly an incredible resource. And I think if there's an opportunity for you to discuss, if your loved one feels open to discussing things with the healthcare provider as far as they're concerned, then I think that's very reasonable to consider. I don't know if others have words of wisdom or guidance, but this is certainly a challenge. Yes, a huge challenge, but I think listening and being open-minded and then I think also encouraging people who aren't vaccinated to remind them of some of the restrictions that were discussed with Alexa, just the travel restrictions and just being really careful because the unvaccinated are much more likely to spread the vaccine or to spread the virus. So making sure that they will really do, if they're not going to get vaccinated, that they continue to uphold the incredible, important, and effective safety measures of keeping their loved ones safe. If others have words of wisdom, there you go. Dr. Chang, please.
Yeah, no, thanks. I agree. This is a very difficult, but if you look at the numbers that Alexa presented and also the clear data, that those who are unvaccinated are the ones who are getting very seriously ill and dying right now from this disease. So if you look at the proportion of patients who are vaccinated, who actually need ICU care or are passing from COVID, it's very, very, very small. And it's very clear the protective effect of the vaccination. But I think the take-home message from this is really the importance of the vaccination to really get a handle, because the stress on everyone, the deaths that we're facing right now, it's 1,800 a day still. And we know that deaths lag hospitalizations. So as we're seeing this surge of hospitalization, we can expect to see more ICU admissions. And so I think it's really trying to say that this is something that is important to protect not only your health, but everyone around you. And so hopefully here we have this amazing therapy that can get us there. And I think it's just trying to have people overcome their fears. A lot of it is fear. A lot of it is mistrust. But the numbers don't, they tell us very clearly what we're dealing with.
Thank you. Thank you, all of you, for those great answers. So we are at time, but there is one more question that I would love to ask you. There's someone who's a bit confused. If you're immunocompromised and just getting vaccinated right now, do you need to get 3 doses? Just to clarify.
Yes, I think the recommendation is for those who are immunocompromised on active treatment that you would receive your 2 doses as you would have, and then would speak with your physicians and probably wait at least a month in order to receive the 3rd dose. I think that's what's being currently recommended.
And that is that in addition to the booster as well, or is that in place of?
The 3rd dose is distinct from the boosters. The booster is something that sort of is really the best term to use for those of us who aren't immunocompromised, whose immune systems naturally will probably start to wane the response to the vaccine. So we'll need a booster shot to kind of reboost our vaccine. I think that the people who are immunocompromised need a 3rd dose in order to essentially have the same level of protection of those of us with strong immune systems who only needed 2 doses.
Got it. Okay. Thank you so much. Well, I really want to thank all of my panelists right now. Thank you, Dr. Chang. Thank you, Dr. Taylor. Thank you, Alexa Greenstein and Jane Rabbitt, for just sharing with us such great information in this really ever-changing environment of COVID. I would want to let you know that we are going to be sending the recording to all of you. So we'll send the recording along with a lot of the resources that were mentioned, the links. So you'll get that in a follow-up email in a couple of weeks. And I do want to ask you if you could please just take a quick survey, just letting us know how you found this webinar. It'll take you literally like 10 seconds. It's just one question. It's really helpful to give us some real-time feedback. And again, thank you so much for joining us. I am glad that you spent the time with us. We'll give the recording to you. And for those of you who are leaving us now, I hope to see you again at a future webinar or event.